Welcome to The Future is Spoken, produced by the Digital Assistant Academy. This show accompanies the Digital Assistant Academy's course entitled Voice Interaction Design. Today, we discover why voice is the natural way to communicate with our technology. Our guest today, Dr. Teri Fisher, explains how voice technology in health and in general is the most logical, useful way to work with our tech. Plus, he discusses the ethical responsibility of notifying users when a realistic voice technology isn't a real person. Enjoy the episode.
So we have Dr. Teri Fisher today with us. Welcome, Dr. Teri.
Hi there. I'm great. Thank you so much for inviting me onto the podcast and the show.
Yeah, it's our pleasure. So Dr. Teri, could you tell us a little bit about yourself?
Sure, I'd be happy to. So my name's Teri Fisher. I'm a physician. I practice sports medicine and family medicine in Vancouver, BC, Canada. I'm a clinical assistant professor at the University of British Columbia. And I like to say that I'm a doctor by day and a big voice enthusiast by night. And I love voice technology. I've been very involved in the voice technology space for I'm starting to lose track now, a couple of years, 2-3 years maybe. And it's amazing what voice technology is going to do for our world.
That's excellent. So this is an interesting thing, like a physician, like interested in voice technology, you have your own blog post, and I've seen you're very active in this, and you do have your podcast, I see, right? So what interested you to get into the voice technology?
Well, I've always been very much interested in the latest technology. I love playing with lots of little gadgets and things. Actually, it's funny. I can remember when I was going to high school, and I'm going to date myself here a little bit, but even before the Palm Pilot, I don't know if you remember the Palm Pilot. There was we have the iPhone now. Before that, there was like the Palm Pilot. Before that, there were like these little sort of, you would fold them open, and they'd have a little keyboard, and you could type in your friends' phone numbers and things, and I would use those because I loved all the little gadgets. Anyway, so fast forward many years, and I became aware of voice technology. Specifically, it started with Amazon Alexa a couple of years ago, and when I started to learn a little bit about what voice technology is all about, I started to realize that voice technology is going to change everything and basically the way that we interact with the world. And one of my backgrounds as well is education. I have an education degree, and I love having the opportunity to talk about technology and to educate people. And when I learned about voice technology, I was able to sort of bring those two interests together: technology, education. And I started my blogs. I have a couple of different podcasts, a couple of different flash briefings. I host online events, and it's an opportunity for me to really bring all those interests together now: technology, education, healthcare, and all that. And it's a lot of fun.
Wow, I can totally see that. I've heard a couple of your podcasts. They are really interesting, and I think it focuses more on the healthcare. So my question to you was I also looked at you keep mentioning this thing a lot, that voice will be the operating system of our lives. So tell us a little bit more, how do you see that happening, and how would voice transform our lives?
Sure, that's something that I'm very that I believe very strongly, and I can start with a little story to explain this. I think that's probably the best way to do this. I can remember when I was about 10 years old, and I came home from school one day, and even then I was very much interested in technology and all the latest gadgets. And I came home from school, and my parents said to me, "We bought this brand new technology, and everybody's talking about it." And they said, "We've got it set up in the other room." So I ran into the other room, and there, sitting on the desk, was our very first personal computer. And I can remember it was a Tandy computer from Radio Shack. And some of your listeners, some of your viewers will remember that those early computers, you'd have to put in a 5 1/4-inch floppy disk and turn on the computer, and then we would wait patiently while MS-DOS loaded. And then we would sit there and we would start typing. And even then, I was so interested in the technology that I sat down and I started to learn how to type and how to use MS-DOS. And I spent hours typing at this computer. And then things evolve, and the technology went from like an MS-DOS disk operating system to an MS Windows. And at that time, that was a big deal, because now we could use a mouse to move things around and click on things. And I can remember drawing little drawings with, those primitive paint programs. It was a lot of fun. And then things evolved again, and it was just over like 12, I think it was about 12 years ago now, Steve Jobs stood up on stage and introduced the iPhone to the world. And that was like a magical device now, because now everything was built into the phone, and you could just tap and swipe and zoom and all this kind of stuff. And that's amazing. But the thing is, throughout this evolution of technology, we have been reliant on hardware. So in the first case, it was a keyboard. In the second case, it was a mouse. And in the third case, it was a phone. And what that means is that we, in the past, have had to adapt the way that we communicate with a computer in order for the computer to understand what we are trying to communicate to the computer, to try to tell the computer, right? We had to use a keyboard. We had to learn how to type. We had to use a mouse. We had to learn how to use the mouse on the screen. And we had to use a touch screen and learn how to use it. Now, obviously, they've become more intuitive, but nevertheless, they are hardware devices. Now, for the first time, due to advances in computing power, the technologies, natural language processing, natural language understanding, the device is now in the background. We can just simply talk. And that's the most natural way that we know how to communicate. And what that means really is that we are not adapting to the computers anymore, but the computers are adapting to the way we communicate. And so now voice is my OS. Voice is how I operate. That is my operating system. And now voice is becoming the operating system of computers. And one of the interesting things that I thought about this, and I thought, well, why is voice so compelling? Why is it going to be the operating system? And I realized that there were 5 main reasons. And I kind of played around with this, and the letters in voice, VOICE, kind of stand for those 5 reasons. And so V stands for versatile, meaning voice is extremely versatile in that you can multitask while you are using your voice, right? Like we could be working out, we could be cleaning the dishes in the kitchen, we could be bathing our children, and we can still be using our voice. We could be driving and using our voice, but we can't be doing those other things, typing, texting, swiping while we're driving. So that's the first reason. O stands for omnipresent, meaning the voice is all around us. We are just like enveloped in the sound of our voices. If I'm looking one way and somebody calls my name behind me, I'm aware of that, right? But if somebody, you can't send a text necessarily to me and hold it up behind me. I'm not going to be aware of it. But with the sound, with audio, with voice, you're aware of it all around you. So that's something else that's quite unique. I. So I stands for innate, meaning when we are born, we use our voices, right? When babies are born, the first thing they do is they cry. They don't have to learn how to cry. They naturally start to use their voice. Whereas anything else that we've had to learn to, anything else that we do to communicate, we've had to learn. We've had to learn how to read. We've had to learn how to write. We've had to learn how to type. We've had to learn how to text. All of these are skills that we've had to learn, but using our voices is innate. So that's another big factor in this. C stands for contextual, meaning you can hear the emotion in my voice, but you can't always pick up the emotion if you're reading something or writing something. I'm sure it's happened to many people where you write an email or you receive an email and the message in that email is misinterpreted because you don't know the context and if they're being sarcastic or if they're being funny, but you can hear that in somebody's voice. And then finally, E. E stands for efficient. Voice is the most efficient way that we know how to communicate. In fact, when we speak at about 3 to 4 times faster than the average person can type. And so if you can be efficient with what you're doing, then, time is such an important commodity, and that's how we can save time. And so because of all of these reasons, voice is a complete game changer. This is a brand new operating system, and I just think it's really powerful. I think it's amazing where we're going to be going with this.
Absolutely. I love that. I love how you broke the entire words, and all of them have like a unique meaning to it. Now that I think about it, yes, like voice is. I keep saying this a lot, that voice comes so naturally to us, but I would always refer to as infants, like, we started speaking. But to your point, like, yes, like kids, this just like a newly born baby just starts crying, so which is amazing. Like, we know how to communicate or express ourselves right from the beginning, so that's so natural to us.
That's
So
right.
where do you
That's right.
see, like where do you see, having used Alexa and other devices, do you still see that these assistants are like 100% natural, or do you still feel that there's, a long way to go when it comes to, like the natural interactions?
So, I mean, certainly there's still a long way to go, but there's also a long way that we have come. Even over the last couple of years that I've been following the space, there have been so many advancements in the way that these devices interact with us. One example is, when we speak, it's natural for us to take a breath. That's what makes us sound human. We don't sound robotic. And sort of, if you go back a couple of years, or the very primitive sort of speech type of computers, they would sound extremely robotic, and they're becoming less robotic. And that's an example of one of the way that things are becoming more natural, because we interpret speech based on breathing and phrases and how we shape our words. And even these devices, things like Alexa, like Google Assistant, Amazon just had their big Amazon event just recently. I think it was just last week. And they announced a lot of their new features. And one of the things that they showcased was the ability for Alexa to take breaths in between phrases. And that makes Alexa sound much more natural. They also showcased the ability for Alexa to jump in and out of a conversation. And that's something that was new as well, so that Alexa can pick up some of the context of what is being said. So yes, I mean, we still have a long way to go. It's certainly not like having a conversation with a human being, but the rate at which we're seeing the technology advance is amazing.
Definitely, yeah. I mean, originally when these devices came, of course, turn taking or bargain, those basic things also were not there. So I see what you mean. Definitely, I see that. And so when Alexa was launched, or when Siri was launched in 2011, the purpose was a voice assistant, which can help you out with certain things like playing music or scheduling and things like that. And slowly the industry has evolved so much that we are seeing advancements everywhere, including healthcare, right? And recently I was looking at the AI survey, and where they were saying like 50% of US adults, said they want to use voice assistant for a variety of healthcare needs, right? So you being a physician, and your focus is more on the healthcare related things. So what unique use cases do you see, which are being used in the healthcare, or where the industry can go?
Yeah, that's such a great question. In my mind, it's sort of like, where can it not go? I mean, voice, I think, can change everything. I mean, I can give you some simple examples. We can get to some of the more complex examples. I would say that, first of all, the more simple things that are already being used, they're actually widely available depending on where you look and what topics you want to explore. But providing information that is easily accessible, seamless, and just on demand. So one good example is the Mayo Clinic. They've got tons of health-related questions that you can just simply ask your voice assistant, and obviously it takes away the need to go sit down on a computer, do a search. You just ask your question and you get your answer, and it comes from a reputable source. Another good example of that would be a first aid skill. So let's say you're at home and you burn yourself, or you cut your finger, or you get a bee sting and you're not sure what to do. You can simply ask the device and it will tell you what to do. And that's so much easier than running around trying to find a first aid manual or doing a search. And if you need to like hold your hand, if you're bleeding and need to put pressure on a wound, obviously that's much better to be able to do hands free. So,
Right.
or maybe you have to actually perform CPR on somebody and you don't remember how to do it. Maybe you could talk to the device, and the device can actually walk you through how to perform CPR. So you're not trying to look at a manual or read something or look it up. It's just telling you what to do. So, I mean, those are some of the more simple use cases where it's providing you with information on demand in an easily accessible way. Then you get into things where the device could be a guide for people with chronic illnesses. And so, for example, let's take somebody with, could be anything. Let's say that somebody just had an operation and they have just had a hip replacement, and they come home, and there are certain things and certain questions that this patient might have. So they could ask the assistant, and the assistant can actually guide them through their post-operative care by telling them what to look out for. Are there, check the wound. Are there any of these signs that might indicate an infection or a problem? And if there are problems, then it could advise the person to go see their doctor. Similarly, say somebody has diabetes, right? Diabetes is a condition that a person would live with 24 hours a day, 7 days a week. It doesn't go away. I should take that back. Depending on the condition, if you eat healthy and you can reduce the effects, but nevertheless, it's a chronic condition. But the patient only gets to see their doctor just a tiny fraction of that time. And so the device could be like a care guide for how to take care of the diabetes. It could remind that person, did you check your blood sugar today? What are your blood sugar readings? Are your sugar readings going up? It could track these things. Is there a problem going on? Did you exercise today? Is that the reason that your blood sugars have gone up or down? Do we need to adjust your insulin dosing? So there's a lot of things, a lot of elements to this that a voice assistant could do, again, going back to being the operating system and being very easily accessible and seamless. I could go on. There's another one like elderly. The elderly population is increasing right now in our world. We know that the population is aging, and there are so many people out there that want to maintain their independence and live in their home. And maybe the problem is that they're becoming forgetful. And so having a voice assistant in the home could act like a care aid for these people. It could provide them with reminders. You know what? Here's the medication you have to take today. And maybe it says, and don't forget, you have an appointment at 2:00 today with your doctor, and your son or daughter is going to come pick you up half an hour before. So be ready for that. And then it can give that person a reminder. And perhaps this voice assistant could actually act like a care aid and keep this person in their home more independent for that much longer. And I think one of the most, I'll give you one more example. One of the most fascinating things to me is something known as vocal biomarkers. And I think the best way to explain this is for people that aren't familiar with this, is to think about this in terms of digital photography as an example and an analogy. Because when you take a picture with a digital photo, with a digital camera, the camera, in addition to capturing the picture, it also captures other data, right? It captures the camera that you use, the model of the camera. It captures the aperture setting, the shutter speed, the flash. It may even capture the GPS coordinates if you have that enabled. So there's lots of other data that gets captured in addition to the photograph. Now with voice, there's a lot more data that can be captured beyond just the words that someone says. And so, as an example, if my son comes home from school and I ask him, how was school today? And he says to me, it was great, right? That's got a particular meaning. And then if I ask him the next day, how was school today? And he says to me, it was great. The words are exactly the same,
Right.
but it's got a completely different meaning. And that gets back to the contextual part of voice. And if you can identify the differences in the way it was said, and computers can, based on algorithms. It's the tone, the frequency, the pauses between the words. There's so many variables there that when you start to plug this into an algorithm, the computer can start to detect emotion, and it can start to detect if someone is depressed, just like we can. If somebody speaks to me in a happy voice, I know that. And if somebody speaks to me and they sound depressed, I can tell that. And the computers can tell that as well. The voice assistants can tell that, the algorithms behind it, the AI. And so what that means is, first of all, these voice assistants can start to make diagnostic impressions based on the way somebody is speaking. And there have been studies, one out of the Mayo Clinic, that shows that there is a correlation between the way somebody speaks and the risk of coronary artery disease. There's also a very strong correlation between the way somebody speaks and if they are developing some type of dementia, like Alzheimer's or Parkinson's. And so these voice assistants can start to make diagnostic impressions and help us to alert us if there are issues with our health. That part, I think, is fascinating to me.
Wow, yeah, definitely. I see a lot of use cases, but the use cases which you mentioned is more towards, like a smart speaker at your home or a smart at your home kind of, right? Do you see some of the healthcare? So for example, I've had like multiple surgeries in the last few years, and all of them were like inpatient, where I was in the hospital for a couple of days.
Mm-hmm.
So one of the surgery was in the pandemic era, I would say, like COVID pandemic, where I had to go through the surgery, and there was shortage of doctors and nurses and everyone. So my surgery was scheduled at 8 o'clock and it happened at 1 p.m. Although it was scheduled for 8 a.m., right? And then the surgery happened and I was super hungry because the whole time, they asked me to not eat anything. And then after the surgery, they, sent me to the room. My husband was not allowed at that time. So I was in the room alone. And then because there was one nurse, there was a shortage of staff as well. I was super hungry, and like the canteen was not working and stuff like that. And it was really difficult to even get hold of a nurse, because I was trying to call, no one was picking up the phone and things like that. So do you foresee, like in hospitals, in like the patient's room or other areas also, these voice assistants could be helpful, like how hotels are trying to bring, voice assistants in there, right? So yeah, what's your take on that?
I agree, absolutely. And we're starting to see that as well. I mean, some of your examples there are perfect examples of when a voice assistant could be extremely useful. So yeah, if somebody is, I mean, again, we can go through some ideas. If somebody is in a hospital bed for whatever reason that is, and it's hard for them to move around, then just doing something as simple as voice enabling the hospital room or the bed, so that they can tell the voice assistant, like, move my bed up or down or turn on the TV or that sort of thing. That stuff is extremely valuable. Again, the thing that comes to mind for me there are patients that have trouble moving around because they may be in pain. Like for patients that have very severe burns in a burn ward in a hospital, it's extremely painful to be lying in bed and having to move around when they're getting treatments for that. And so having a voice assistant can be extremely beneficial for them, and it can actually help to relieve a lot of that pain. So that's one example. The other example is something that you touched on there is, communicating with the healthcare team, communicating with a nurse. So right now, if somebody pushes the button to call a nurse, right, the nurse has to, whatever they're doing, hopefully they finish whatever they're doing, they come to the patient's room, they ask the patient what the issue is. Maybe the patient says, "I'm cold, can you get me a blanket, please?" So the nurse then goes back to the place where they store the blankets and then comes back again and gives the patient a blanket. So the nurse has taken like a number of trips to get a blanket, right? So what if the patient instead just said to the voice assistant, "Could you please ask the nurse to bring me a blanket, I'm cold?"
Right.
And all of a sudden the nurse just grabs the blanket and brings it, and that's the end of that. That's it. It's so efficient. For the same reason, what about from the healthcare providers in the hospital? Perhaps instead of having to do all of their notes by hand, they actually speak to the voice assistant and say, "I just saw this patient and this is how they're doing." And they basically just dictate it into the voice assistant. Along those lines in a doctor's office too, there's a lot of companies that are looking at enabling voice assistants to allow for automated, transcribed notes into the electronic medical record to save time and save efficiency, which is a big issue with physicians and record keeping, and that's a whole other issue. There's a couple examples. Another one is in an operating room where people have to be sterile, and it's so much easier to simply speak to the assistant and say, "You know what, could you please put up on the monitor the latest x-ray of this patient's knee?" Instead of having to either get the nurse to do it or push buttons or worry about breaking your sterility out of the sterile field. there are so many things that can be done with voice specifically about that, keeping things sterile. And that's actually a really important,
Right.
topic given our current COVID situation.
Oh yeah. Oh yeah, definitely. I love that. Yeah, definitely. I do see, some of those use cases. So where is the industry? Do you see, hospitals or healthcare providers actively looking at these kind of use cases? Technology takes time and adoption is a big thing, right? So where are you seeing the trends in terms of hospitals looking at similar kind of use cases?
So hospitals definitely are looking at this. I will say, this is not without challenges. I mean, one of the big challenges is protecting patients' privacy
Right.
and making sure that these devices are, at least in the United States, HIPAA compliant. In different countries, there's going to be different regulations. And that's a very interesting issue because yes, we need to protect the patient's privacy. And there's a lot of risk aversion in healthcare in general. That's why the healthcare sector tends to move a little bit slower compared to other sectors that are adopting technology, simply because there's a lot of risk with health, right? If you make a mistake or if you do something erroneous, then the consequences can be very severe. And of course, with privacy and security, protecting patients' health information is very important. So getting back to your question then, hospitals definitely are implementing this, but they're doing it, I think, in a very careful way for the most part. And I know with like Amazon Alexa, they're slowly rolling out their HIPAA compliant features to select hospitals at a time so that they can test things and make sure that things are in compliance. And so, yes, hospitals, healthcare facilities, the entire health industry is very, very much interested in the in the voice technology applications with regards to healthcare, but it does take a little bit of time. Now, having said that, COVID is accelerating everything.
Definitely. Yeah. Do you see, I know robotic surgeries and stuffs like that are pretty common these days, right? So do you see, a merge with the robotic surgery and voice together happening anytime soon?
Yeah, that's really good. That's a really great question. Absolutely. Because again, the more that you can control with your voice, then you can do other things with your hands. And, we are going to see that where the robots are going to be controlled by a voice. And then, like I say, it allows you to multitask. It always comes back to one of those VOICE things. When it comes when it comes to the robotics, if the surgeon's hands are busy doing something in particular, and they don't want to let go of whatever they're doing at that moment, but they want to do something else, or they want to bring in another instrument, wouldn't it be amazing to then say to the robot, whatever that command is, can you show me this, or can you move this? And so they've got their hands here, and the robot's doing something else, and now they're multitasking by using their voice. So I think that's going to be one of the real benefits of voice with robotics. We're going to see there's going to be a lot of technologies that come together. We're already seeing models of VR, virtual reality, AR, and this sort of stuff where surgeons can now manipulate things in space and have a look at things before they're operating to come up with a pre-op plan, and then they can start to move things and talk to these models and do things by voice. It's a really exciting time when it comes to surgeries and robotics and all that kind of stuff, virtual reality.
That's amazing. Yeah, I see a lot of potential and it's very exciting just to look at the future. One question I had was, you did mention that, about the voice, like it was robotic. Now voice assistants are being more, humanized. I'm also writing a book about it called Emotionally Engaged Digital Assistant. So that is why my question to you was, how Alexa is now adding pauses and things to the voice. Do you see, people getting into the uncanny valley because of those reasons? Or, because I pretty much see the moment, like a bot or a machine starts to, become too much human kind of, there are problems as well. So what's your take on that?
That's a very, very interesting question. To be honest, I'm not sure that I have a great answer for that. I think time will tell to see how people respond to it. what I can tell you is that from my own personal experience and from some discussions with people, the more natural that these voice assistants sound, the easier it is to have a conversation with them. And then because it's easier to have a conversation with them, it is easier to offload tasks and responsibilities to the assistant that can then make your life easier. So I guess what I'm trying to say is that the more natural they sound, the more efficient they become, and the more people are likely to use them to increase the efficiency in their lives. Now, do we get to a point where that's too much? I don't know, but I think what is important to know is if you are speaking with a voice assistant or if you're speaking with a human being. If it ever gets to the point that these assistants truly sound like like you're talking to another person, then I think, at least at this stage, I think ethically, then I think it's important for that assistant to at least identify itself as an assistant so that you know who you're dealing with.
Right.
Like I know I'm sure you're familiar with the Google Duplex, where an assistant can make a reservation for you through a restaurant or whatever the case may be, and that sounded pretty amazing. But then on the other hand, you kind of think, are we tricking the person, or should the device say, "Look, I'm an assistant acting on behalf of whatever"? I think that's probably a little bit more appropriate, but I don't know. I mean, it's a great question, and I don't know that we have clear answers on that one yet. But it's a very important thing that I'm glad there are some people that are thinking about that.
Right. Yeah, definitely. There are pros and cons to the technology, and as we, especially in the COVID world, many people are remote, virtual, and lonely. So when they start talking, I pretty much see if these assistants are not transparent and ethical. Like Google Duplex, definitely I feel like although it is a great feature to have, but the way it communicates or approaches is not that great, and I feel like there has to be some transparency as well. So there are ways to solve for this, but I definitely see have you seen the movie Her?
Yes, I have.
Yeah. So pretty much like that, although, the user knows that, he's talking to a machine, but still, he starts to get some feelings or starts to feel, love for the machine, right? So
Right.
I definitely feel like, with voice assistants, there will be some social responsibilities, which these companies also have to start thinking about as we want to, expand it to different use cases.
That's right.
One more question I had was I do that, and I know many people would do that. We become our own WebMD. If something is there, we Google, and then we are like, okay, what is this? Why am I vomiting? 5 times or something
Right.
along those lines, and you'll get all sorts of answers, including cancer in many cases. Right.
Yep.
So do you see, some of the use cases which you mentioned, would have these kind of panic attacks from the users because of, the symptoms or things like that which were identified or diagnosed by the assistant?
Yeah. So, in one way, there's some similarities to other technologies here, and in another way, there's differences. There's similarities and differences, of course. I think that when it comes to the average person Googling health concerns, they're going to find whatever information they want to find. Okay. And that's going to be the same whether they're searching online or hopefully not. But this is where there's some responsibility with the people that are producing the skills, the applications that are going to be on the voice assistants. If a person wants to go and, search for a skill that is going to answer some health related questions, then there's a certain responsibility both to the person searching and to the person producing the skill to look at the source of that information. And so one of the things that I actually really like is when you ask, for example, when you ask Alexa a health-related question, Alexa will tell you the source. So Alexa will say, according to the Mayo Clinic, and it gives you the answer. which then is first of all, it's coming from a reputable place. And that's the same with when you Google online, right? You could go to a website that's not reputable and has false information, or you could choose to go to a reputable site. We'll use Mayo Clinic as an example, and where they have evidence-based information. So that's the first part of that, is making sure that your information is coming from a reputable source. The other part is, could the device cause, a panic in a person? And I think, again, that's up to the designers of the device. It's very different for a device to say to somebody, here's a good example, you have COVID. Because there are actually companies right now, it gets back to that vocal biomarker thing that I was talking about. There are companies right now that are doing research into being able to diagnose COVID based on the sound of someone's voice and the sound of their coughing, for example. And so it's very different for the assistant to say, oh, I heard you speak and I heard you cough and you have COVID. So isolate yourself, right? Or they may take the approach of, you know what? How are you feeling? I might ask a couple questions and say, based on what you're saying and the way you sound, your risk might be a little bit higher. I would suggest that you go and speak with your doctor to actually confirm this. And so it's a different approach. Now, could somebody get very panicked when they hear that? They could. But somebody could get very panicked when they search a website and the website says, oh, your risk might be a little bit higher of getting diabetes for whatever reason. So, so to answer the question, there are some similarities between searching online and listening to the voice assistant. And number one, it's important on the designers to make sure that it's reputable information. And number two, it's important to be empathetic in the way you present the information to hopefully not cause undue alarm.
Right. So it eventually boils down to the conversation design and how we design the dialogues to, communicate the messaging.
Yeah, I think the voice design, the VUI design is critical in healthcare. As a physician, when I went through medical school, we specifically took classes on communication. Wow. So how do you speak to a patient in a way that shows empathy? How do you speak to a patient in a way that encourages them to share with you some of what they're concerned about, some of their fears and that sort of thing? And there are very specific strategies that you can use when you're speaking with somebody. And I think that it's critical for the VUI designers to take into account those strategies. And I know what they do. The ones that specialize in healthcare, that's what they do. And they take into account some rapport building in the conversation design, ways to encourage that trust, and ways to be very sensitive to what a person is feeling. And so, I think it's really important that when it comes to designing these specifically healthcare skills, that healthcare professionals are involved in that process, and you've got designers that are really looking at communication skills.
That's amazing. So, we are approaching our time. So I have one last question for you. So
Sure.
Do you think the voice is you also talk about, medical education a lot, right? So do you think, voice is being considered or used for medical education or will be used in the future?
Yeah, I can actually think of two specific examples come to mind of projects that I know about. A good one is, for example, for nursing. And this could apply to physicians as well. So, one of the things that medical healthcare professionals will do in their training is, of course, they practice scenarios. And they have a simulation lab where, there's a simulation of a patient that, whatever the case may be, they're in cardiac arrest or whatever it is. And so I know that, for example, there's a nursing program here where I live at the British Columbia Institute of Technology where they have used voice assistants in their simulation lab. So as the nursing students are running these simulations, they actually are talking to their voice assistants, and the voice assistant is giving them more information as they need it through the simulation. So at some point they're like, oh, I wonder if we got some blood tests on this person, what would they be? And they ask the voice assistant, okay, what are the blood tests for this, what are the blood results for this patient? And the voice assistant tells them, and they continue on with the simulation. So it's part of the simulation, which is really, really interesting. There's another company that I know of, MedFlash Go, and what they're doing is they are allowing medical students to study using their voice assistant. And so what they've done is they've basically created a series, a data bank of questions, of almost like flashcard type questions. And a medical student, when they've got some time, they can just ask their voice assistant, can you quiz me on a couple of these medical related questions? And the voice assistant will just do it with them so that they can do it whenever they want. They don't need anything else with them. And it's a way to reinforce what they're learning. Those are just two that come to mind. There are many, many more as well.
That's amazing. That's amazing. I can definitely see. Do you see so for example, when I go for my right, and they would check my vitals, and then there is a person who's manually entering everything in the system before the doctor comes, or all the different note taking or things like that, which is manually done right now. So do you see those kind of things will also be automated through voice, or maybe people, or because of the variations of the accents and things, we are not yet there? So what's your take on this one?
I think we'll eventually get there. The short answer is yes. I think we're going to get to the point where the voice assistants are taking some of that medical history. A lot of the times I'm asking the same questions to patients, which are quite routine questions as far as I'm concerned. It's like, what medications do you take? What allergies do you have? Now, sometimes, yes, you need to clarify certain aspects of that. But a lot of those questions could be, automated by the voice assistant, by the patient. And here's the really neat thing about this, is that these voice assistants are so cheap relative to other technologies to just get a voice assistant in your home, that this can be done at home in advance of the visit. And so it not only will it help to take some of that information, but it also helps to decentralize the healthcare, because now the healthcare, it kind of gets back to what I was saying before. Now the healthcare is in the individual home, is in the individual homes, and not necessarily in the hospital or in the clinic. The other part to this is that I believe that voice, because of the vocal biomarkers, are going to become another vital sign. So right now, of course, physicians take blood pressure, they take your pulse, they may take your temperature, your respiratory rate, and so on. There's these vital signs that doctors use. With voice, as we learn more and more about the way different diseases sound, voice is going to become a vital sign. And again, the interesting thing is this is in the home. So you've got this vital sign that's being monitored, potentially, again, it gets back to the privacy issue. You've got this vital sign that's being monitored on an ongoing basis or a periodic basis, and it's completely in the background. It's completely non-invasive. You don't have to have anybody touch you to do this in any way. And so I think that voice can actually become another vital sign for physicians.
That's amazing. Yeah, I mean, definitely, the healthcare potential looks really much more than any other things, because at home there are other options, and the context also is different. So all your use cases and your all the things you're talking about, especially in terms of healthcare, I feel like will be super helpful for people. Definitely with this will come a lot of demand for voice designers and UI designers as well. So yeah, I feel this is great. Thank you so much, Dr. Teri. It was a pleasure talking to you today.
Thank you so much. And I encourage people to get in touch with me if they'd like to. You can, I've got lots of resources, but probably the best place to go is actually just simply my website at drterifisher.com. And I'm happy to chat with anybody about any of this stuff. I love talking about it.
Sounds good. Yeah, me too love talking about voice technology. So I will make sure we are adding all your links into our show notes as well. So anyone who wants to contact you, they will be able to do that. So thank you.
Wonderful. Thank you very much for the opportunity. I really enjoyed chatting with you about this. And what can I say? I really appreciate it very much.
Likewise here. You have a great day.
You too.
Thanks for listening today. Remember, you can find all the information on how to become a certified voice interaction designer, along with show notes and more, at our website, digitalassistant.academy. That's digitalassistant.academy. We encourage your feedback and questions, so be sure to get in touch by using the contact page at the Digital Assistant Academy's website. We'll include the link in the show notes. In our next episode, Diana Deibel, a design director and co-author of the upcoming Conversation with Things, will discuss